What get measures get managed, and in epidemiology, what get measured can save lives. Jai Hind and warm greeting to respected principal sir, head of all the department, our guest speaker, my dear students. I, Dr. Supurna Pandit, on behalf of entire Department of Public Health Dentistry, warmly welcomes you all to today's online international guest lecture. Epidemiology is the backbone of public health, and measuring disease is one of the most important jobs. By finding out numbers like how many new cases happen, how many total cases exist, and how many people sick or die, we understand where the health problems are and why they happen. These numbers help us to decide what to focus on, plan a solution, and check if they are working. In today's world of new and ongoing health challenges, correct measure is the key for quick and effective function. The main objective of this session is to understand the importance of measuring the disease, prevalence, incidence, morbidity, mortality, and explore how accurate data help us to identify health problems and guide public health action and evaluate the success of intervention for better population health. Now, I would like to invite in charge Department of Public Health Dentistry, Dr. Sanchit Pradhan sir, to kindly welcome our guest speaker for today.
Jai Hind everyone. I welcome our today's guest speaker, Dr. Pawan Krishnamurti, in this interesting online international webinar titled Measuring Disease in Epidemiology. We are honored to welcome Dr. Pawan Krishnamurti, who is a public health dentist and an anthropologist with a multidisciplinary background in dental care, clinical research, epidemiologist, and biostatistics too. She had completed her BDS from MS Ramaiah Dental College and MDS in public health dentistry from SDM Dental College, Dharwad. She has also completed MSc in health ecology and human evolution from University Dalhousie from France. Dr. Pawan Krishnamurti has authored multiple peer-reviewed publications, presented papers at national and international conferences, and contributed to innovate projects in oral health and public health research. Her expertise spans teledentistry, oral health behavior, and health communications. She has numerous credentials in her credit. And now, without any further ado, I would like to invite Dr. Pawan to kindly start with the deliberation. Thank you, Dr. Pawan, and Jai Hind.
Jai Hind, first of all, Jai Hind sir, and thank you for welcoming me. Thank you to all the teams and the entire members for welcoming me. It was very kind and the introduction was awesome. So let's start the webinar. So as such, I can understand it's afternoon time. So it's nap time. So let's start with the positive motivation. Yes, so I will start. 1 minute. It's not going to screen. Okay. Yes. So as sir has suggested, today's topic is measuring disease in epidemiology. Epidemiology is very important topic in the public health. So let's see what it is. So before starting the webinar, what is the learning objective? What are we going to learn from this webinar? So first, I'm going to define the epidemiology. Secondly, we are going to see how to identify and classify types of variable used in epidemiologic studies. Third, to explain hypothesis testing, p-value, and confidence interval. Next, we are going to see describe how disease frequency is measured in population, then understand the cause-effect relationship in epidemiology, interpret key measure of association, and access measure of potential impact of exposure on disease burden. And lastly, we are going to see how to recognize the uses of measuring disease in guiding public health action. So, as ma'am has said, what is epidemiology? So, I'm going to just briefly introduce what is epidemiology. As you are well aware of also that but just from where the this definition has come. So epidemiology is defined from the word epidemic. The word epi means among, and demo means people, and logos means to study. It was introduced in the 19th century, and the latest definition was given by the John in the year 1988. It is the study of the distribution and determinant of health-related states or event in the specified population and application of this study to the control of health problem. So, in the health research, whatever we are doing related to the sector, to the public health, the epidemiology is very important, and in that we need to measure distribution and determinant to finally control the health problem. So before going into the epidemiology and how to measure, first we should understand the types of variable. Without understanding types of variable, we can't understand how it can be measured. So the variables are divided into two parts: quantitative variable and categorical variable. Quantitative variable, in the simple word, it means the variable which you can measure. So it is divided into two parts: continuous and discrete. The word continuous means which take value within a range, like for example, age, height, or blood pressure. It can't be in decimal, it can be in decimal, but for the discrete, it can't be in decimal. So it will always be taken as the whole number only. Like for the number of children, you can't say 1.5 or 2, but for the continuous, it can be in the decimal value. Like age can be in decimal also, like 1 year, 5 months. Now, the second category of variable is categorical variable. It is divided into three parts: nominal, ordinal, and binary. The categories with no natural order. The variable which takes no natural order, like marital status, it could be either bachelor status, unmarried, or married. So it means, in the simple word, it doesn't take any type of ranking order. While the term ordinal, the category which have meaningful order, which takes ranking, like satisfaction label. So you can give ranking for the ordinal variable. So where the data which has the ranking, that will come under ordinal. While the binary, which has only two categories, like either positive or negative test result, so it can be categorized into two part: positive or negative. So only two value you can take for the binary. So next important is hypothesis testing and p-value. So for measurement of the disease, these two are the major role. So everything's evolved around these two value. So beginning with the hypothesis testing in research, it began with the null hypothesis and alternative hypothesis. So we are having two hypotheses: null or alternative. So null hypothesis, that for the example, that there is no difference in alcohol consumption between men and women, while for the alternative hypothesis, there is difference. So our research, whenever we are doing research in the public health or in the any type of health research, there are two types of option which we call alternative hypothesis or null hypothesis. So basically it is assumption. So we will be taking two assumptions, so whether it will be null hypothesis or alternative hypothesis. And then we need to determine the p-value, that is probability of observing our result, or more extreme, assuming that null hypothesis is true. So we will make assuring that whether null hypothesis is true. So if the value is less than 0.05, we need to reject null hypothesis, and we have to say that this is statistically significant difference. But there is one reminder, that p-value is continuous, and don't treat 0.05 as a strict cutoff. Although in the literature it has been said that 0.05, we take it as strict cutoff, but in the simple word, if it is 0.04, it doesn't determine that it is less than 0.05, it just shows that whether we need to reject null hypothesis or alternative hypothesis. But yes, if it is very less than 0.05, then the strength of evidence against null hypothesis is very strong and we need to reject null hypothesis. Now, the third most important thing is confidence interval. So, what is confidence interval? It is a range of possible value of the population estimate, and most commonly we take 95% confidence interval. The confidence interval give you a range of possible value of a parameter like mean difference, proportion, or regression coefficient. So, practical interpretation of 95% confidence interval is that if we repeat the study many times, 95% of the confidence interval would contain the true population value. So, what does it mean? So, let's understand with the example. Let's assume that the sample mean weight is 70 kg. So, 95% confidence interval means that 65 to 75 kg of the population mean will likely between the 65 and the 75 kg. So in simple word, we can say that when the confidence interval is narrow, it will be more precise, while when it is wide, it will be more uncertain. So next we are going to see, which is the main theme of this webinar, is measurement of disease frequency. In a simple word, these things are also used in the mathematical frequency. But to understand the epidemiology, we must understand these terms. So, first one is the count. It is the simplest measure, just the number of cases or event, like how many people are affected by disease in the given population. So, we are just telling the count. So this is the simple term count. Second one is the ratio. This one defines is the comparison between the two numbers. The group being compared don't have to be related. So in the ratio, the numerator which you are taking, it should not be the part of denominator. Like for example, male to female ratio in the study population is 40 to 60. So 40 is to 60. So male and female both are different part and they consist ratio. Now the third, which is the most important part and most of the parameter of the epidemiology are under proportion. So the proportion is a type of ratio where the numerator is part of the denominator. So it shows how much of the total is affected. Like for the example, 25 out of 100 people tested positive. So 25 among 100 people. So these 25 people are actually comes under these 100 people. So these 25 are part of the 100 people which are tested positive. So it consists proportion and we are getting the result of 0.25. Next, which is very important, rate. So rate is defined as the frequency of event that occur in definite time period. So whenever we are relating anything with the time period, it will consist rate and it will be divided by the average population at risk during that time. So general formula for rate is numerator by denominator into constant multiplier. Constant multiplier according to the population size you can take either 1,000 or 100. So it depends upon the suitability of the uh, mathematical tool what you want to take. So sometime you might see 100 or 1,000. Just to give the convenient number, we multiply with the constant multiplier. So just for example, like the crude death rate, which is also one of the very important parameter in the epidemiology, it defined as the number of death in 2000 divided by mid period population. Most of the time we get confused at why we take mid period population, because we take mid period population because the average population is highest is assumed to be at the time of the mid period. So that's why for the convenient we always take mid period population. Now the next important term is mortality, fertility and death. In epidemiology, all our measurement evolve around these three terms. So most often we see these three terms, which are often get confused. So let's see what it is. So this is rate. So the mortality rate is defined as death of the particular disease or event in a total population. Let's say for the example maternal mortality. So mortality rate defined as number of pregnancy related death in the defined place and time period divided by number of live birth into 1 lakh we are taking in this. Now what is fatality rate? Fatality rate is the proportion of people diagnosed with specific disease who die from it. So, whenever we are taking for the specific disease, it is known as the fatality rate. So, it is defined as death from the disease divided by the total diagnosis cases of the disease into 100. Even in this, if you are not determining percentage, you can take 1000 also or 1 lakh just to make the convenient number. But since already here percentage is added, so don't get confused. We have to take 100 for this. And next one, that is death rate. It is mortality of all disease among the total population. So death rate means all the disease by which people are getting death. So we are taking all the diseases like just say for the example in the population people are getting death by cancer, COVID. So in that case we have to take all the scenario of COVID, uh, cancer patient, so everything. While the fatality rate, if you are measuring, you just need to take one specific disease. So that's the difference between these two. Now, commonly used rate for the population study are age-specific death rate. So, whenever we are taking age-specific death rate, we need to see it in the this ratio. So, in this, we have to check number of death in the particular age group. So, just we are taking the definite age group. It can be in the adult age group, child age group, or the old age group, determining uh, the prevalence of the disease. And as I have said, denominator in this, we will be taking mid-period population of the same age group, place, and the time period and divided by 1000. Second one is cause-specific death rate, in which number of death due to particular cause in the defined place and the time period divided by the mid-period population into 1000. So for the particular cause, whenever we are taking death rate, it will be coming under cause specific death rate. Next is infant mortality rate, that is number of death to infant which are under 1 year of age in the defined place and time period divided by number of live birth. Next is perinatal mortality rate, in which we are taking number of stillbirth plus number of death to infant less than 7 days of age divided by total birth. So total birth will consist of these live birth plus late fetal death, which is number of stillbirth plus number of live birth. Now the next most important thing by which we measure epidemiology. Mostly we are going to see in the epidemiology the uses of prevalence and incidence. Most often we are coming in these two terms like prevalence or incidence, and people get confused what these two terms are. So in the simple word, prevalence means number of existing cases of disease, means all old cases plus new cases. So actually it is a proportion of individual in a population with disease or condition at a specific point of time. So prevalence means number of cases observed at time t by total number of individual at time t into 100. And this is the example like existing cases of diabetic in the sample is 5000, while in the city total number of the people are 10 lakhs. So the prevalence will be 5000 by 1 lakh into 100. So we are getting 5% of the city of the population. So the prevalence is divided into two parts. One is point prevalence, and the second one is the period prevalence. So the point prevalence is the proportion of a population at a specific point in a time, while the period prevalence will defined as the specific period. Like for the example, if you will see for the point prevalence, we are just taking this one for the 1st September 2009. So these will be in the point prevalence like 2, 4, 5. And if we are taking the data for the 31st December, 6, 7, 10 will be coming for the point prevalence. Now the confusion is that why we are not taking one, because in this the person or the person has is already dead. So because of that we are not taking this case. We are only taking the case which are crossing this graph, this rectangular line, this straight line which is crossed, we are taking only this. But for the period prevalence which are taking, these all will come except this, because the case is already dead, so we don't have to take this one. Apart from that, we have to take all the cases. So this is the difference between point prevalence and the period prevalence. Now, next is incidence. So, incidence means it is measurement of new cases of disease that develop in a population during a specific period of time. So, whenever we are taking new cases, it is incidence. But if it is old cases plus new cases, it is prevalence. So, there are two types of incidence. First one is cumulative incidence, while another one is incidence rate, also called as incidence density. So let's see what these two terms are. So the cumulative incidence is number of individuals who get the disease during a certain period with the ratio of number individual in the population at the beginning of the period. So it is a proportion because this numerator is a part of denominator. It has no dimension and it varies between 0 and 1. So let's see the example of the cumulative incidence, like a company which has 500 employees who are all disease free at the start of the year, but during the next 12 months, 25 employees develop influenza. So cumulative incidence will be new cases in 1 year and population at risk at start. So it will be 0.05. So the interpretation we are drawing it here is 1 year cumulative incidence of influenza is 0.05, or in a simple word it is 5%. So it means that each employee had a 5% probability of getting influenza during that year. Next is incidence rate or density. So what it is, so in a simple term, it is number of new cases that occur during a calendar period among the population time contributed by the observed candidate population during that period. So whenever we are taking time with the population time period, it is incidence rate or density. So it is not a proportion, it has dimension and it varies between 0 to infinity. While what we have seen in the cumulative incident, that it is proportion, but this one is not a proportion. So in this we have to be sure that this is not a proportion and it has a dimension. So example of incidence density, like in 2003 the number of new cases of sexually transmitted infection was 29 among the men aged 40 to 44 years, and the person year was 41,532 among that group of people. So what is the incidence density or incidence rate among those people? It will be 29 divided by 41,532 person year. So this one will be the incidence density. So here see, there is person time and here it also has unit. So this is the incidence density and it has proper dimension. So, in the simple word, we can see that prevalence is old cases plus new cases, while incidence is new cases. These two terms are often get interchangeable. So, I just want to describe it with the diagram. So, new cases which we are adding up here is incidence, while the old cases which are already existing in the sample is prevalence. So prevalence will be all these, while death is happening here, so this we have to exclude. But for the incidence, only the new cases. Next is very important terms in the measurement of epidemiology, which we often come across, and all the criteria revolve around this. So this is cause-effect relationship in epidemiology. So cause-effect relationship means that an exposure actually produces or contribute to an outcome. So here is the cleanup diagram for the cause-effect relationship in epidemiology. And we start with the population without a disease. So this population doesn't have a disease, but then people will have disease. So they will get contaminated by the disease. So now people without disease, but then they are exposed or contaminated, so then it will be divided into exposed or not exposed. So in exposed, people who got contaminated, they might develop disease, or some people might not even develop disease because might be they are having vaccination or some protective measurement, while in non-exposed might be people get disease or might not be getting disease. So it depend upon the immunity. So we have started without disease, but then because of the exposure or non-exposure, which is because of the immunity or the protection, people have developed disease. So in the epidemiology, this 2 by 2 into 2 table are very useful, and we have to understand the cause effect relationship. So since because of the exposure and disease, so exposure when we are having, it might lead to development of disease while it might not be. So this is the commonest method to show how the disease have developed with the exposure and without it, to understand the other method which we used in the epidemiology. So because of that, it is useful to understand 2 into 2 table. So here exposure and disease. So yes, if exposure they are getting and they have developed disease, yes, so this is the one which was exposed and they developed disease, so A will be coming under. And the person who has exposure but it has not developed the disease, it will come under B. And like that, these boxes has been created. So the measure of association. So the next important things which come under in the measurement of epidemiology is measure of association. So it is the statistical relationship between two or more events, characteristic or other variable. It is statistical relationship between exposure and disease. And one thing is that association is not causation, because we have seen that exposure not always cause the disease. So because of that, it is being said that association is not causation. So they can be grouped into relative measure or absolute measure, and plus some standardized comparison. So relative measure, what is this relative measure? So in a simple word, these compare the risk in the exposed group to that in the unexposed group. So the most common relative measure are relative risk, odd ratio, and rate ratio. In relative risk, it is risk exposed divided by risk unexposed. Odd ratio is AD by BC, which we are going to see in the future slide how they have determined. And the rate ratio, when it is when we are taking incidence rate exposed divided by incidence rate unexposed. So relative risk are mostly used in the cohort or the RCT study, in which you can measure the incidence. Odd ratio, when the disease are rare, then in that case we take, like in the case control cross section, or sometime in the cohort study when you are using logistic regression. And rate ratio are used when incidence rate with the percent time we are taking then it is used. So it is taken in the cohort study or sometime even in the randomized control study. So let's see what is relative risk, because it is the most commonest measure of association. So relative risk is a measure of association that compare the risk, that is probability of health outcome in people who are exposed to certain factor with the risk in people who are not exposed. So the formula is risk in exposed group divided by risk in unexposed group. So as I have shown in the previous slide that how the table is formed. So for the calculation of relative risk, we have to draw this type of table, and the formula is this. So A divided by A plus B. So we have taken expose, how many people are exposed in total. So that will consist of denominator, while denominator, it will be how many people which are getting exposed with disease, and then denominator will be uh, all the person who are not exposed. So this is the formula, and this is the useful method for the cross tabulation. So just to determine relative risk. So for that, I have shown in the past slide how it is drawn. So interpretation of relative risk. So when it is one, it will be no association between exposure and disease. So it shows that incidence rates are identical between groups. But if it is greater than one, it will be positive association. And it shows that exposed group has higher incidence than non-exposed group. But when it is less than one, it will be showing interpretation of negative association or protective effect. So it shows that non-exposed group has higher incidence. Example like 0.5, half are likely to experience disease. Next is odd ratio. So odd ratio is the ratio of odd of a condition in the exposed compared with the odd of the condition in the unexposed. So it is usually applied to the prevalence studies rather than the incidence studies, and it is a ratio of the odd of disease in exposed by unexposed, as I have said earlier. So this is the cross tabulation. Remember in the past slide we have seen the formula. So the formula has come from here. So basically it is the cross multiplication from here to here. So AD by divided by B into C. So now next is absolute measure. So in the association we have seen relative measure. So next important is absolute measure. So absolute measure is actually just show the difference, while relative measure, it will be showing the ratio. But when we are doing the difference between two, it will be absolute measure. So in absolute measure, four parameters are there: risk difference, attributable fraction, population attributable risk, and population attributable fraction. So risk differences, risk exposed minus risk unexposed, while attributable fraction is risk exposed uh, minus risk unexposed with the denominator risk exposed into 100%. And when we are taking the risk in the population as a whole, then it will consist of the population attributable risk. And same goes for the fraction when we are taking for the percentage. Now, next is standardized measure. So, as I have said earlier, it is relative, absolute, and standardized. So, the third one is standardized, which is taken for the age or other confounders when comparing population. So, it consists of two measures: standardized mortality ratio and standardized incidence rate. So, in the standardized mortality rate, it is the numerator with the observed death, while denominator with the expected death with the percentage, how much percentage we are getting. So the interpretation will be, if it is greater than 100, mortality is higher than the standard population. And the last one is standardized incidence rates ratio, which is similar to standardized mortality ratio, but this one will be only taken for the incidence. So then it will be standardized incidence ratio. So this is the difference between these two. So let's see again as a summary that what is measure of association in epidemiology. So it consists of three parts: relative, absolute, standardized. In relative, we have relative risk, odd ratio, and rate ratio. While absolute, it is risk difference, attributable fraction, population attributable risk. While standardized measure, it will be two: standardized mortality and standardized incidence ratio. So, just to explain it again, relative risk of will always come under the ratio, while absolute whenever we are doing difference. So, if it is ratio, it is relative risk, but when we are doing difference, it is absolute risk. So, the key difference between relative risk and absolute risk difference is that in relative risk, how many times more likely the event is in one group versus another. So actually it is a ratio as we can see it from here. While in the absolute risk, it is the extra cases caused by the exposure, because we are taking as the difference, and it has unit cases per population per time. As we can see it here, it has the unit, but here there is no unit. So now next one, that is the last one, is the measure of the potential impact. So measurement of epidemiology consists of measure of potential impact, which is very important parameter. So this help us to estimate how much disease in a population could be prevented if we remove or control a certain risk factor. So what they are? So these measure actually tell us the expected contribution of particular risk factor, that is exposure, to the overall frequency of disease in a population. So in a simple word, if we eliminate this risk factor, how much disease would disappear? So it will just tell that like for the example, if you will remove the risk factor, like for the asthma, it developed because of the polluted air. So if you are removing the pollutant, so how much risk factor is removed, how much the prevalence of disease is reduced because of that. So that is the measure of the potential impact. Like for example, again, if smoking is eliminated, how much would lung cancer rate drop? Or if everyone got vaccinated, how much would measles cases decline? So it is expected contribution of a particular risk factor. So that one is determined by the potential impact. So why they are useful, why we are doing potential impact? So for it is used for the public health planning to prioritize intervention. Example, which program give the biggest health benefit for the investment. Second one is predicting intervention impact, like can estimate the benefit of preventive measure like vaccine or screening program or lifestyle uh, changes. And third one is for the policy justification, that provide evidence for laws or funding. Example like seatbelt laws banning trans fat. So the key idea, that is the combination of the frequency and association. Why we have learned frequency and association? So that we can measure the potential impact. So the frequency measure tell us how common the disease is in population, that is prevalence and incidence. So because of that we have learned, so that we can determine how common the disease is in the population. And association measure, why we have learned, so that we can tell how strongly the exposure is related to the disease. Like we have learned relative risk and odd ratio, which tell how much exposure is related to the disease, how much it is strong or weak for the disease. So the potential impact takes these two factors, and then we consider potential impact for uh, both, that how common the risk factor is and how much it increased disease risk. Like for example, a rare but very dangerous exposure may have less population impact than a common but moderately risk exposure. So the common example of potential impact measure is attributable risk, population attributable risk, preventable fraction, and number needed to treat. So attributable risk is excess risk in the exposed group that is due to the exposure. Population attributable risk, which is excess risk when we are taking for the entire population due to exposure, while preventable fraction is proportion of disease that could be prevented if intervention is applied. And the last one, that is NNT, that how many people need to receive intervention to prevent one case. So all these four are the common example of potential impact measure. So, measure of potential impact are like a forecast tool for public health. They tell us how big of a dent we could make in a disease by tackling a certain risk factor, taking into account both risky it is and how common it is in the population. So, for this, how risky it is and how common it is, because of that, we are measuring potential impact. So, these two parameters it determine. So, how potential impact measure are derived? So let's see this example. We are taking risk factor, frequency measure, and association measure. So as I have said earlier, potential impact, we have to measure these two factors, frequency and association. So frequency measure how common is the disease. So we for this we have to take incidence, prevalence, and the association measure how strong is the link or exposure, and the risk factor, what are the risk factor, and we need to combine these to measure potential impact. And potential impact we can measure by these four tools, which is attributable risk, population attributable, preventable fraction, and NLT. So this attributable risk will tell us the impact for the exposed, means how much extra risk they bear, while population attributable risk tell us for the population. So when we are taking population as a whole, then population attributable risk is used, and it combine how risky the exposure is and how common it is. So a factor with high exposure or relative risk but low prevalence may have small population attributable risk. But conversely, a moderate relative risk but very common exposure can have large population attributable risk. And that's why frequency plus association are used to measure potential impact. While NNT, it will just translate AR into practical measure for intervention. So, as we have seen how we are measuring disease in epidemiology, so now we are going to see what is the usage of it. So, why we are using it, why we have learned measuring disease in the epidemiology. So, just the first one and the most important to determine or identify disease frequency and distribution in population. Second, Secondly, to detect outbreaks and monitor trend over time. Third, pinpoint high risk group for targeted intervention. Fourth is to evaluate effectiveness of public health program. Fifth, to guide resources allocation and health policy decision. And the last one is to estimate burden of disease to prioritize prevention effort. So, lastly, I want to conclude this webinar by telling that measuring disease in epidemiology through frequency, association, and potential impact provides essential insight into how disease occurs, who is at risk, and how intervention can reduce the burden, guiding the evidence based public health action. So, if you have any question, you can ask, or even if you can contact me through my ID. And thank you very much.
Thank you so much, ma'am, for such an enlightening lecture. We have queries from our student side.
Yes.
That is, ma'am, that is showing on the screen in just a second. Uh, How do we decide which measure of disease frequency, incidence, prevalence, or mortality is most appropriate for a specific public health program?
Okay, first of all, very nice question. Thank you for the question. Okay, so it will be decided according what type of the study you have taken. Okay, so according to the study type, first of all. So let's see if you have taken a study in which you are determining how many people are dead by the COVID cases. So if you want to measure the new cases, then you have to take incidence. Okay. But if you want to check in the last year, in last year, how many people have died, then you need to uh, do prevalence. Okay, and mortality is the rate, so that is different thing. When you want to determine the rate of the people, how many person are died, then you need to take mortality. So it is according to the definite time or what parameter you are taking, whether you are taking age specific or just crude specific, or as I have said earlier, infant mortality, or different type of category what you want to take. So that will determine which type of mortality you are taking. So according to the study type, you have to determine whether you are taking incidence, prevalence, or mortality. And mortality is different, so don't get confused with that. And incidence and prevalence according to old cases or new cases, what you want to determine according to your study type. So are you clear?
Yeah, thank you so much, ma'am. We have another question, that is, how do you decide whether to use incidence or prevalence as a primary measure for a particular oral health study?
Okay, so then again, what you want to take, the new cases or the old cases? So oral health study, which type of oral health study you want to take, means dental caries, periodontal diseases, or malocclusion. So first you need to determine the disease which you are targeting, and then you have to decide the incidence or the prevalence which you want to take as the primary measure. So you need to see the study type and design of the study, and then you have to check for the incidence and prevalence. Mostly in the oral health study we take both the incidence and the prevalence, we take both. Okay, is there any other question?
No, ma'am, thank you so much. Now, I would like to request our respected Principal and Dean, Dr. Nikhil Srivastav, sir, to kindly say a few words of wisdom and certificate of appreciation for our guest speaker of today.
Hi Pawan, how are you?
I'm fine, sir. How are you?
Good, good, very well. Thank you very much for your time and taking out the time for the lecture.
Thank you
Uh,
so much, sir, for giving me
I
the
wouldn't say it's
opportunity.
complete, but then certainly whatever I have heard, it was a simple way of explaining the epidemiology, which is very important. And
Yes,
your department particularly, because we have one department, public health dentistry in our college, where Dr. Sanchit Pradhan and Dr. Suparna all are working. So I keep telling them that it is very important for you as a public health dentist to just tell us as a clinician what is the disease burden, what are the
yes,
different types of diseases which are prevalent in a local area, and you keep guiding us that you have to take certain measures to curb these diseases or to alleviate these diseases.
yes, sir. Yes, yes.
Epidemiology indeed is a very important topic.
Yes, I have tried to simplify, but it is very vast topic,
I
and
understand.
so I have tried to finish it in 1 hour. But yes, it is very complicated, and
Not only complicated, but it is very boring also.
I don't find it boring, but since
You are the
but
specialist, no?
yes,
You, Sanket,
yes,
Suparna, you people are the specialists. Maybe you find some interest in it, but for us, it was always a very nightmare kind of thing. And because in our time,
yes,
there was no public health dentistry, right? When we were studying,
yes,
public health
yes.
dentistry was not a subject. So
Yes.
were not exposed to these kind of studies.
Yes, yes, yes,
So
yes.
actually, I started learning and studying all these things when I became the examiner for the first time in
Hmm.
1999 for
Hmm.
this subject. It was,
Okay.
forced upon me that you should take this particular subject and you will be the examiner, internal examiner. So this is how I started reading and then understanding the concept. I mean, it
Okay.
is no doubt about it. It is the basics of any research, right? You need to
Yes,
know
it
all
is
things, right?
basic. Yes, and in everywhere in other sector also we are using, means for not only for
Absolutely.
the dentistry, in all the medical specialty we need to say it, and then
No,
accordingly we
and
need to plan.
no, no, no. Whenever you visit India, no, I will just try to call you in our institution also,
Yes, sir.
and
I
because
will be very
every
thankful for.
year, yeah, every year we just keep holding or organizing these kind of lectures and workshops. So I
Okay.
think twice or thrice in a year for postgraduates, sometime for undergraduates, for ourselves also. So
Hmm.
people do come. If I'm not wrong, last time, no, Dr. Nitesh, no, he's also my junior, some 13, 14 years junior to me in KGMC. He's currently working in AIMS, New Delhi. He had
Okay.
come and gave the original lecture for this.
Ah, yes, 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 yes.
But anyway, how's your health?
Yes, it's fine, sir. It's now okay.
When is the D day?
9th September.
9th September. Okay, not very far. So wish you
Yes.
all the best and best of health.
Thank you.
And
Thank you so
on
much.
behalf of my college and then my colleague in the public health industry, kindly accept this certificate of presentation.
Thank you. Thank you so much. Thank you.
And whenever you visit or if you say, then we will, post you the hard copy of this also, right?
Okay, sir. Okay, no problem. Yes.
Thank you, Pawan. Thank you for your time once again. And
Thank
we
you,
will
sir.
take feedback from the students and
Okay.
the result we will try to mail you. Okay.
Okay, sir. No problem. Okay.
All right. Thank you. All the best. Bye bye.
Thank you, sir. Thank you. Bye.
Uh, on behalf of Department of Public Health Dentistry, I would like to thank our guest speaker once again for sharing her knowledge today. We would also like to extend our heartfelt gratitude to founder of Subhati Group of Institute, Dr. Atul Krishna sir, and late Dr. Mukti Bhatnagar ma'am for being a guiding light. And also, we like to extend our sincere thanks to our CEO, Dr. Shalya Raj ma'am, for motivating us. We would also like to thank our Honorable Vice Chancellor, Professor Dr. Pramod Kumar Sharma sir, for his love and support throughout. We extend our sincere thanks to our Executive Officer, Dr. Krishna Murti sir. We extend our sincere heartfelt gratitude to our esteemed principal and dean Dr. Nikhil Srivastava sir for his exemplary guidance and always motivating us and pushing us to do even better every time. Thank you so much, sir. At the end, I would like to thank the head of my department and my departmental team for providing me this opportunity. Last but not the least, the Macron department, especially Mr. Jatin and Mr. Shubham, PPD department. Thank you all once again and Jai Hind.